Hello, everyone. My name is Vincent Patz, and this is my informative speech on arm injuries in baseball. So, I want everyone to raise their arm and pretend that you're throwing a ball. Now, imagine doing the same movements thousands of times in a year, but each time you have to use 100% of your strength, accelerating the ball to speeds over 95 miles per hour. For baseball players of all ages throughout the world, this motion isn't just a part of the game, but it's also what can lead to career altering and sometimes life affecting injuries. Throughout my own journey as a young baseball player, I recall how much emphasis was placed on not how hard you can throw, not just by coaches, but also by my fellow peers and fellow players as well. There was a constant focus and competitiveness that drew a lot of people's attention away from the safety aspect of throwing, and this left negative consequences on several players, including myself. So, my own personal experience and injuries led me to do some research and kind of get to the root cause of many of these injuries. And I found that through studying and learning more about how the human body works, I have a deeper appreciation of how we're designed, and I know exactly what to do to help keep myself and other players safe during throwing sports. So, today I'm going to share a lot of this knowledge with you, and I'm going to talk about some of the main causes of arm injuries and like the effects that they can have on a player, not just physical but also mental. And then I'll give you some of a little conclusion and a recap and some advice that you can use if you are a fellow baseball player or know people who play baseball and struggle with this stuff. So, when you think of arm injuries, the main thing that comes to your mind is overuse and excessive pitching. So, that is one of the main drivers of all injuries. Things like throwing too many pitches in a game, season, and practice can all build up and lead to breakdown of the essential ligaments in your arm. So, also, a lot of players try to play baseball year round, which I personally believe is not a good idea, especially as a pitcher, because it leaves your body with very little room to use its necessary healing powers that kind of, keep you healthy and can be able to compete at 100% of your capability. Another thing that can contribute to arm injuries is poor throwing mechanics and muscular underdevelopment. So, the lack of proper technique is another kind of obvious answer, but it can put unnecessary strain on your tendons and ligaments if you do not use proper mechanics. So, it's important that players learn to throw properly from a young age and build good habits that help you avoid future complications due to lack of proper throwing form. Another thing is many players skip training their stabilizer muscles. So, for example, there are a lot of small muscles in your back and in your shoulder and arm, and those muscles can be torn by more dominant muscles if you do not train the smaller ones. Stabilizer muscles contribute to the deacceleration of the arm during throwing, and when they're not properly trained, they put more strain on your tendons, specifically your UCL, which is the tendon inside of your inner elbow. Another more obvious answer is inadequate rest and recovery. So stuff like this can slow the healing process that occurs each time you throw, and players that continue to throw and push past fatigue and soreness can increase their risk of injury. So, rest is also important not just between seasons, or not just between games, but between seasons themselves, and it is highly important that players do not skip rest. Utilizing proper techniques for recovery are important as well. Things like cold compresses and running can help your body recover, so you're not playing in the next game with any type of pain or soreness that could hinder your performance. Some of the effects of arm injuries are tendonitis or nerve pain, specifically in your shoulder or elbow. And if these things are ignored, they can lead to larger injuries like a UCL tear, which requires surgery to repair. Injuries can also lead to a decrease in performance, which can have long-term effects on how you play. Stuff like a reduction in throwing velocity and limited endurance in a game can lead you to recover slower, and that in turn can help the injury to compound. And compound injuries are just a bad thing. It just leads down a bad road. You want to catch it and avoid it as soon as possible. Baseball injuries can also leave an effect on your mind, so they're also sort of mental injuries. Many players face long recovery periods that can affect their everyday lives. So, in the case of like professionals, Tommy John surgery requires physical therapy and rehab, even to be able to get back to day-to-day life. As if you have a surgery like that, you're not able to use your arm for a substantial amount of time, and that can leave lasting effects. These injuries are also, they can be quite traumatic and can lead players to have anxiety or a fear of re-injury that can affect their confidence and potentially hurt their careers. So, when looking at the whole big picture, I don't think that these injuries should prevent a young athlete from playing baseball, as, injuries are present in any sport or any activity that you do, but knowing what causes them and how they can be prevented can drastically reduce their chances of happening. So things like stretching, ice, tracking how many pitches you throw, and taking proper rest days are all methods that players around the world use to keep safe, and I think that they should be practiced on any sports team, from the youth level to the adult level. And that's my speech. Thank you.